It is critical that we understand how cancer develops because cancer remains the #2 cause of death in the United States. In fact, cancer has become the #1 cause of death for those aged less than 85 years in the United States. Although the cancer death rate is slowing in the United States, the rate of cancer deaths are rising worldwide. Approximately 600,000 people are estimated to have died due to cancer in the United States in 2013. The most frequent cancers are lung, prostate and breast, and colon, the big three. Notice that the next most frequently occurring cancer death rate is in the pancreas, which we will refer to again in just a moment. Cancer will touch almost everyone's lives, as the probability is that 1 in 3 women and 1 in 2 men will develop cancer in their lifetimes. Another point to consider is that cancer death rates are significantly higher in African Americans. It is not clear if this difference is due to genetics, access to health care, or lifestyle factors, such as the increased rate of obesity in African Americans. In addition to deaths, there are many in the United States who develop cancer each year, which is a huge financial and personal burden for the patient and their families. Almost 1.7 million new cases are estimated in the United States in 2013, and the number worldwide continues to increase. It is notable that although the number of new cases of pancreatic cancer is relatively low, it is much higher on the list for cancer deaths. This is primarily due to the fact that pancreatic cancer is often not identified until a late stage and is sometimes an aggressive cancer. The later the stage of the cancer at diagnosis, the poorer the likelihood of survival or prognosis. Another example of this is breast cancer, where success in increasing detection and treatments has led to mortality rates for breast cancer dropping dramatically, with an estimated overall 90% survival at 5 years after diagnosis. Survival rate, however, is dramatically influenced by the stage of cancer at the time of diagnosis. Nearly 99% of breast cancer patients live 5 years past diagnosis when the disease is identified really early in the progression to a tumor. In contrast, only 24% of patients live past the same point when the disease is diagnosed at a later stage, that is, when the cancer cells have moved to a new site in the body or metastasized. Because of improved and increased amount of screening to detect early cancers, as well as improvements in treatment, the death rate has leveled in both men and women. It is estimated that this change in the death rate due to these strategies has averted over 1 million cancer deaths since 1991. In fact, it is estimated that with what we know now, if effective strategies were implemented to make lifestyle changes only, approximately 50% of cancer deaths could be prevented. The impact on reducing cancer incidence and death could be even greater if we include what we know about the relationship between obesity and cancer. Obesity is considered one of the few lifestyle factors where there is sufficient evidence to support that higher adiposity or fat increases risks for cancer. A prospective study by Calais et al., which included 900,000 men and women, suggested that obesity was linked to the risk of many different cancers and linked to 90,000 cancer deaths in the U.S. every year. Excess body fat, another estimate says, may account for 1/4 to 1/2 of the occurrence of many frequent cancers. Cancer is also a complex disease, and generally we think that no two cancers are alike. Cancer is a multi-stage process that requires more than one factor or hit. This figure is a simple depiction of how cancer is thought to develop. Cells, these yellow ovals, grow until they touch other cells, and then they stop growing and mature to their final form, which performs the function of that cell type, otherwise known as differentiation. If cells have a genetic mutation or environmental exposure, they may begin to grow out of control, but this growth is still limited. It requires another hit or two to fully lose control of growth and gain the other characteristics of cancer cells, including bringing in blood vessels to feed the cells as the tumor grows, avoiding cell death or suicide, otherwise known as apoptosis, that occurs naturally in order to get rid of cells that have these mutations, and also the cells change the ability to leave that tumor and go to another site, otherwise known as metastasis. Cells also take up blood and use far more of the energy source, glucose, when they become cancer cells. Although in some cases the cancers are very aggressive and develop very rapidly, in most cases the process can take a very long time, maybe 30 years, and maybe even another generation. This makes it very difficult to study what we can do to prevent cancer, such as reducing obesity. A very good example of this is smoking. Who thinks that smoking causes cancer? Well, there are some who would say that we don't really know that yet, because the gold standard, a randomized, controlled clinical trial, has never and will never be done. This would require that we take a group of people and we randomly assign them to smoking for the rest of their life. And we take another group of people and randomly assign them to not smoking for the rest of their life, and then following them for their lifetime and determining how many develop cancer. Fortunately, we did not wait for this kind of a trial to make recommendations to stop smoking. As a result of these recommendations and the many programs and policy changes used to implement these recommendations, this figure shows that as the per capita cigarette consumption declines, the male lung cancer rate declines in a similar fashion, but approximately 30 years later. This is similar to what we expect for obesity. Our best evidence is that those who lose weight reduce their risk for cancers. We also need to consider everything we know about cell, animal, and other kinds of trials in order to develop recommendations. The best we can do for our adult obese population is to determine how obesity increases the risk for cancers and identify how we can target specific interventions to modify those factors, particularly given how difficult it is for adults to lose weight and then maintain that weight loss. Even better, preventing the development of obesity beginning at a very early age is really the best approach. Obesity is also a complex disease, and we do not know yet which of the factors that occurs in obesity is linked to increased cancer risk. There must be more than one, because not everybody who is obese develops cancers. One of the things we have learned is that adipose tissue, or fat tissue, is not just a storage site for fat in the body, but also releases many factors or hormones that control what some of the rest of the cells in the body decides to do. That is, it's an endocrine organ. When people become obese, the environment changes in the adipose or fat tissue, and the cells release different hormones from those in people who are lean. In people who are obese, the adipocytes become very large and then surrounded by inflammatory cells, mainly macrophages, creating what is termed crown-like structures. Therefore, many more inflammatory cells are recruited into the adipose tissue. It creates a state in the body as if there were constantly foreign factors, like an infection, and so the body makes and releases factors leading to inflammation, and therefore obese people are in a chronic state of inflammation. As you've already heard, obesity promotes diabetes and resistance to insulin. These factors, inflammatory hormones, increased insulin, and increased glucose, are known to have effects on cells, such as breast and colon, to promote the changes in cell behavior consistent with the development of a tumor, and so may be some of the reasons for the link between obesity and cancer. So it is really important to reduce childhood obesity, because this may help to prevent many cancers in these children when they become adults.